Imagine this. You walk into a routine checkup, hoping for peace of mind, but instead, you leave with fear, more tests, and even treatments you might never have needed. After 70, some common screenings quietly carry more risk than protection. Today, I'll reveal 5 surprising checkups that can put your independence on the line, and the safer choices that many seniors wish they'd known sooner. Most seniors believe more checkups mean more safety. But here's what the research and my own patients have shown. After 70, certain tests can backfire. Overdiagnosis climbs, recovery slows, and independence quietly slips away. If you've ever felt uneasy before, yet another test, you are not alone. In this video, I'll walk you through 5 checkups to approach with caution, and how to partner with your doctor to stay safe, wise, and strong. 1. Mammograms and overdiagnosis. When Margaret turned 74, she walked into her mammogram appointment expecting peace of mind. She had no symptoms, no family history, and she just wanted to be safe. Instead, she left that office with fear written all over her face. The scan showed a shadow. Within weeks, she had more tests, then a surgery. Only later did her doctors admit the growth might never have harmed her at all. Margaret's recovery was harder than the problem itself. She's not alone. A 2023 study in the Annals of Internal Medicine followed more than 54,000 women over 70. The researchers found that 31% of mammogram diagnoses in women 70 to 74 were overdiagnosed. In women over 85, that number soared to 54%. In plain words, more than half the alarms were false alarms. Why does this happen more with age? Part of the answer lies in a process scientists call inflammaging. Imagine your body's immune system as a home alarm. In your younger years, it only rings when someone breaks in. But after 70, that alarm becomes overly sensitive, blaring at shadows, even dust. 2 chemical messengers, interleukin-6 and tumor necrosis factor alpha, rise sharply in older adults. That chronic background fire makes the body more reactive. Scans pick up harmless changes, while recovery from biopsies or surgeries becomes slower and riskier. So, what's the safer path? For women in their mid-70s or older, who are otherwise healthy and have no strong family history, many experts suggest it may be time to stop routine mammograms. Instead, focus on breast awareness, gentle self-checks and noticing changes, and make screening decisions together with your doctor, not out of habit. For higher-risk women, mammograms can still save lives, but the choice should come from informed wisdom, not fear. But this isn't just about women. The next test quietly traps millions of men and carries its own hidden risks. 2. Prostate cancer screening, PSA tests. Frank was 72 when his doctor suggested another PSA test. He'd had several over the years, always normal, but this time, the number came back borderline. Within weeks, he was scheduled for a biopsy. He spent sleepless nights worrying, his wife pacing the living room with him. The biopsy left him sore, anxious, and in the end, the results were harmless. All that pain and nothing dangerous was found. This isn't rare. A 2022 systematic review of 19 clinical trials looked at cancer screening in older men. The researchers found that prostate cancer overdiagnosis can reach 38% in men over 70. Nearly 4 in 10 men are told they have cancer. That never would have caused them harm. Why does this matter more after 70? It comes down to how aging hormones affect the body. Cortisol, the stress hormone, rises by as much as 80% in older men. At the same time, insulin sensitivity weakens, fueling inflammation. Think of it like pouring gasoline on a small spark. A minor, slow-growing prostate change gets exaggerated into a medical fire drill. And once that cascade begins, tests, biopsies, surgeries, Each step carries more risk for infection, urinary problems, or even lasting complications. So, what's the safer approach? Many experts, including the U.S. Preventive Services Task Force, suggest men over 70 with no strong family history or symptoms may be better off stopping routine PSA tests. Instead, focus on urinary health, movement, hydration, and shared decision-making. For those with family history or symptoms, screening may still be valuable, but the choice should be individualized, not automatic. Gentle question. Have you ever faced a test that left you more anxious than reassured? Share in the comments. You'd be surprised how many others have felt the same. And here's the bigger picture. If tests can cause this much stress, what happens when surgery itself enters the story? 3. Emergency surgeries and frailty. Helen was 80 when she was rushed to the hospital with sudden abdominal pain. Doctors told her she needed emergency gallbladder surgery. She survived the operation, but she never walked the same again. What the doctors didn't say that night is that the surgery itself carried almost as much danger as the illness. A 2024 study in the Journal of the American College of Surgeons, analyzing nearly 60,000 elderly patients, found that mortality rates for emergency surgery reached 22% in people over 80. 1 in 5 never make it home, and those who do often face months of lost independence, frailty, and cognitive decline. Why does this happen? Aging bodies are like bridges weathered by decades of storms. Inflammaging, that constant low-level fire of IL-6 and oxidative stress, weakens the structure. Muscles shrink, recovery slows, and blood vessels lose flexibility. When surgery comes suddenly, it's like repairing that old bridge in the middle of a storm. Even the strongest repairs may not hold. This doesn't mean surgery is always wrong, but it means preparation matters. Doctors call it prehabilitation. Simple steps like light strength training, protein-rich meals, and breathing exercises before a planned surgery. And just as important, advanced care planning, asking, what quality of life do I want after this? These conversations give seniors and their families a voice before the crisis. Emergency surgeries will always carry risk, but when you know the odds, you can choose wisely, prepare better, and sometimes avoid procedures that leave more scars than healing. And yet, sometimes it's not the surgery itself that steals memory and independence. It's the medication that puts you to sleep. 4. General anesthesia and cognitive decline. George was 76 when he had hip surgery. The procedure itself went smoothly, but what came after frightened his family more than the injury. He woke confused, struggling to remember names. Weeks turned into months, and though he improved, he often said, "It feels like someone dimmed the lights in my mind." This isn't rare. The Mayo Clinic study of aging, published in 2019, followed 1,819 seniors ages 70 to 89. They found that 36% experienced measurable cognitive decline within 12 months after anesthesia and surgery. That's more than 1 in 3. Memory lapses, fog, or even long-term delirium. Why does this happen? Aging brains rely on 2 fragile systems, melatonin and GABA. Melatonin, the hormone that signals night and repair, drops after surgery. Meanwhile, GABA, your brain's calm-down chemical, declines steadily after 70. General anesthesia works by amplifying GABA's effects. But in older brains, where reserves are already thin, the sudden surge can knock delicate circuits off balance. It's like turning off the lights in a house for repair. But when the power comes back on, not every room lights up again. What can seniors do? First, always ask if local or regional anesthesia is an option, especially for orthopedic or skin procedures. Studies show these approaches carry a much lower risk of delirium. Second, protect your brain before surgery. Good sleep, omega-3s, and gentle movement strengthen neural resilience. And third, involve loved ones. Having a familiar voice and routine during recovery helps reorient the brain. Here's where it gets interesting. Even when the surgery and anesthesia go well, the next screening, one of the most common after 75, can carry the biggest hidden risks of all five: colonoscopies. After 75, Ellen was 78 when her doctor scheduled a routine colonoscopy. She'd had them before with no problem, so she didn't think twice. But this time, the recovery was different. She developed bleeding, fatigue, and days in the hospital. What was meant to be a simple check left her weaker than she had been in years. Her story reflects what researchers are now warning. A 2021 meta-analysis in JAMA Internal Medicine found that complication rates from colonoscopies double after age 75. Risks include bleeding, perforation of the colon, and adverse reactions to anesthesia. For many seniors, the risks begin to outweigh the potential benefits. Why does this happen? After 70, the gut microbiome, that's community of trillions of bacteria, changes. These shifts affect how the body processes sedatives and repairs tiny injuries. Blood vessels become more fragile, tissues heal slower, and the delicate balance of the gut makes recovery harder. It's like using a jackhammer when what you needed was a small brush. The tool is too rough for the job. So, what's the safer alternative? Many experts now recommend stool-based tests, such as the fecal immunochemical test, FIT, every 1 to 2 years. These are non-invasive, can be done at home, and carry almost no risk. If something unusual is detected, a colonoscopy may still be appropriate, but it's targeted, not automatic. What most people don't realize is that more testing doesn't always mean more protection. Sometimes it means more complications, more stress, and less independence. And in just a moment, I'll challenge the biggest myth about checkups after 70. A belief that even many doctors still repeat. After 70, health isn't about chasing every possible test. It's about choosing wisely, protecting not only years of life, but the quality within those years. Think back to Margaret, Frank, Helen, George, and Ellen. Each trusted a checkup to keep them safe. Yet each also learned that sometimes the risk comes not from illness, but from over-testing itself. Their stories remind us of something essential. Wisdom in aging often means saying no as much as saying yes. If you've ever felt uneasy about another appointment, another scan, another lab, you are not alone. Thousands of seniors share the same quiet question. Is this test helping me, or simply adding fear? That question isn't weakness, it's strength. It's the voice of someone who wants to stay independent, present, and whole. So here's my invitation. Before your next checkup, pause. Talk with your doctor. Ask, how will this test change my care? What are the risks for me, at my age, with my history? And then make that decision with clarity, not fear. Because the true goal after 70 isn't more appointments. It's more mornings with your spouse, more stories read to grandchildren, more laughter shared with friends. Now, I'd love to hear from you. Have you or a loved one faced a tough decision about a screening test? Share your story in the comments. It could guide another senior through the same uncertainty. And if this perspective helped, I invite you to subscribe to Healthy Aging Hub. Together, we're building a community of wisdom where every choice brings you closer to living well, not just longer.